for 12, 14 years, Chris.
Yeah, exactly.
If you pick up any newspaper nowadays over the last 3 to 5 years, you're probably aware, or a little bit aware, of healthcare reform and the effects on everything from employers, the spend of what's going on, to the plan designs, to everything involved with it. Depends on what side, I guess, of the political aisle you fall on. There's good, there's bad, just like anything. The government, I guess the intentions are good, but some of the execution of these intentions aren't as clean as they'd like it to be. I can answer some health reform questions as we go on, and how it may or may not affect you or your kids or dependents. But I want to kind of work this backwards a little bit, because we are going to be making a change. We're making a change not only in a carrier change, but in a paradigm change of a plan design. So I know for years we had Aetna in here for years. We made a switch to Blue Cross, one of their proactive plans, which was or is a tiered, leveled hospital doctor plan. And these are the parts of healthcare that have gotten a lot more confusing, where narrowing networks, tightening networks, what is covered? Hey, everything's covered, but everything's only covered if you go to these doctors or this, that, and the other. So some of those things have to be addressed, and knowing which plans and how that all works. The first thing I'm going to hand out, and I brought Tris, I can get you plenty of these and scan you over to as well. This is us. So back there. KTB, and I work it backwards, because in years past this would be kind of the last thing I would talk about. But if you have questions regarding your health care, your plan design, how it all works together, because you're going to have some different moving parts, and I'll get into that, call us, 866-KTB-SERVE. You're always welcome to call Aetna. You're always welcome to do that. But if you have a question on something, and you have a claim issue, and something doesn't seem right when you get it back, your explanation of benefits from the carrier, let us wait on hold for 45 minutes. Leave a email, or email, call. Let the folks that your broker world do that. So it's a good service where if you go to prompt 1, you typical, if you have to order a new card, or if you have a claims issue and you want to delve into something or how it was done. I can't sit here and say, oh, we can get every claim paid possible. What you'll get, or what you will get, is an explanation. Sometimes that claim, you'll be explained why or why not something was done the way it was done. 2 is a health advocacy prompt, which is more clinical. So if you have questions, if you need to get a knee operation, go see an orthopedic surgeon, and you don't know who to go to, that prompt 2 can give you, that connects to another service of ours that you'll speak to a registered nurse. They'll handle your case. If you have a high-level situation going, chronic disease management, diabetes type things like that, they can work with you on that world. We don't have it on this brochure, but we also have a prompt 3. Prompt 3 is a new prompt for us, where it taps into buying healthcare through the marketplace. So we all hear about the marketplace and healthcare.gov, and it's also called Obamacare. It depends what you read. The ability to go in and to buy that. So a lot of times folks have dependents or one-offs we talk about now that say, I need my brother-in-law or something. They can call prompt 3. They put in code. They'll be prompted. They'll be asked for a code, which is 036. I'll send that to Chris as well. Doesn't really pertain to you all, because you still get benefits from your employer.
So are these services at no additional cost to the company or to the individual?
Yeah, these are all
okay.
These are all baked in.
Freebies. Relative.
Yeah, they're all correct. That's in our world. We're still, as brokers, it doesn't for Aetna. We're dealing with Aetna and IBC in the under 100 market. The rates are the rates, as they say, whether there's calling directly to Aetna, dealing with a broker. So these are added-on services that we feel differentiate us in the marketplace and getting those things done. I can talk about if you have questions on the healthcare.gov and things like that, but that prompt actually is healthcare.gov, but you don't have to go into you don't do it yourself. You have someone helping you do it. So I know some folks, hey, I did the thing. I know it got a lot of bad press 15 months ago. I'm scared. I don't want to go into healthcare.gov. I have to fill out my application, things like that. So just so keep that in mind. What we're moving you into, and this is where we're going to get the moving parts a little different. We are moving you back to Aetna with what's called it's an HSA compatible program. And the reason why I say compatible, and this is where it's going to get confusing, is there's a lot of acronyms in the healthcare world. Health savings accounts. A lot of you, if you research some of this stuff, have heard of health savings accounts. There are also, some of you may have heard of HRAs, health reimbursement arrangements. Okay? Health savings accounts are health savings account plans, compatible plans, are programs that the federal government has basically said, look, you're allowed to have an HSA with this plan design. So that begs the question, what does an HSA allow one to do? It allows one to put monies away to pay for costs of their medical plan. Or it allows the employer to put monies away for the cost of the employer for the medical plan. Why I bring this up, because interestingly enough, and of course healthcare, as interesting it is, the plan you're going to is an HSA compatible plan, but you won't be utilizing the HSA portion of it. Okay? And I'm going to get into what that means. So what I'm going to do, what now is, this is the plan design of your new plan. Over there. Now, the unique thing with what's going on and why it's a paradigm shift in a good way is that a lot of these plans that you see in front of you are sold just as they are. If it's sold just as it is, it's an HSA or an HSA compatible plan. Now, before we go down the benefits, the key on this plan design is there's a huge deductible. There's a huge deductible, which is a negative thing, right? Sales guy talking negative. The positive thing is, and this is where the paradigm shift in a good way is, that 1Source and the folks are choosing to fill your deductible with what we call an HRA, a health reimbursement account. Okay, so there's going to be two moving parts with your health plan now. You'll have an underlying health plan with Aetna. Okay, with a $3,000 deductible if you're a single, and a $6,000 deductible for all others. Huge deductible. Okay, and if that was all that I was saying today, it would be sticker shock for you all, because you're coming from a different world, different plan designs. But what we're doing, and what 1Source is doing, and Chris and the folks are doing, is they are choosing to fund your whole deductible. Okay? They're funding your whole deductible. I have to keep saying that out loud. Because at the end, what happens is, you have to think of this as these HSA type compatible plans. Because when you leave here, you're going to go back and say, the guy's telling me I have an HRA, but the plan design says HSA. Because the HSA is the compatible program. Okay? And how that gets funded is the choice of an employer. An employer could offer this to its employee group and say, we're not funding it at all. You want to put money out of your own pocket and take out pre-tax and put it on a side fund? You can do that. You want to set up a separate bank account at your bank to set up an HSA? You can do that. That's not what we're using it for. We're using the HSA with the deductible to fund it through an HRA. Okay? And the HRA allows you, the employee or the member, to, when they have that deductible usage, it gets reimbursed. All right? So, I'm going to hand out. So as we're going to be talking about two different things at the same time, because the hardest part to kind of sometimes get a grasp of is the fact that the marrying up of these two plans. When we marry up the HSA compatible program, which is actually the health insurance plan, with the HRA, which is the payer of the high deductible plan. Is anybody familiar with HRAs? Like, they have neighbors or family members that work maybe at a larger company. Typically, HRAs are put in at a larger type environment. Okay? And what happens is those deductible fillings can be, there's not a law on how the company fills deductibles. The law is just that it has to be for Section 213 of the IRS code, which is the fancy way of saying medical expenses in the IRS code. So when the HRA is filling your deductible, it's filling that gap for you as an employee, which is important. So looking at your plan design, so we'll go to the Aetna SBC. Now if you notice, all the SBCs now, to get any of these, are the way the ACA or Obamacare is written now, all the carriers have to provide a very similar SBC, a summary of benefits. Okay? The key to understand this is when you look at the top left there and it says to you, the plan, it's got a little cut off, this PA Bronze HMO, it's 3,000 HSA. And you jump down to that first important question. What is the overall deductible? For each plan year, the individual is 3,000, the family is 6,000. Understand that deductible applies to everything. Applies to everything. So when you go to the pharmacy for the first time on March 1st, you're going to be in a situation where it applies to deductible. You got to go you get a sinus infection, you want to go see your doctor. It's going to be subject to deductible. Okay? So, understanding that deductible is that underlying number first, and then after that, similar to car insurance, after deductible, the plan kicks in. Okay? By and large, now Chris and I have talked about this, 12 life group, you don't have the law of statistics to figure things out. But most likely, knock wood, most of you will not go through your deductible. So most of you won't even use the Aetna portion of your medical plan this year. I take that back a little bit, and I'll explain why. I'm in a similar plan like this. I have a family deductible, similar $3,000 situation. I've been in it now for 6 years. And fortunately, we haven't spilled over the deductible. We've used the majority of it. I have 4 kids, so we've broken some things and cut some things and gone to the places that you got to go to. But at the end of the day, we've been fortunate there's been no major things we've had to go into and jump into, quote unquote, as they say in our world, being in benefits. Okay, after deductibles, then what they call being in benefits. And I say that, I take it back about not having Aetna kick in, because it's important in this process. You do have doctors that you go to that are in the Aetna network. You still are under the Aetna umbrella of their network. Excuse the pun for them. But that means, in a good way, you enjoy in the discounts of the Aetna negotiated rates with their doctors. Now, twofold. If you were paying that deductible yourself, that would be extremely important. Because 1Source is paying the deductible, it's extremely important for 1Source. Because they will pay the negotiated rate with your doctor. So, for example, if you had to go to a doctor for you get your sinus infection, and you went to your doctor, and you go to the office visit. If I asked everybody here what their office visit for their doctor, or the majority of the population, they'd throw me out the copay number. Oh, it's $20 to go to the doctor. Oh, it's $40 to go to the doctor. Or it's $60. No, that's your copay. The cost of the doctor's visit typically is about $120, $130. the negotiated rate that that doctor has made with the carrier might be around $80. It's usually about a 40 to 50% discount that that doctor has negotiated with, or his practice, or the bunch of doctors. So it's usually about a 50% discount. You as a member typically don't even pay that 50% discount. You've been paying copay. Well, now you're basically paying that number, or 1Source is paying that number. So that negotiated rate of being part of a network and being part of that, in that world, helps the payer of that deductible. Like I said, if it was you, you'd want that negotiated rate lower. When you go to the pharmacy, you want that negotiated rate lower. Okay, but these are all expenses that 1Source is going to be paying for you to fill that deductible. Yes?
Do we pay that $120 first and then 1Source reimburses us, or does 1Source pay it?
Good question. Stop. Yes, you're reading ahead. No. I'm going to explain how the HRA is going to work. No, so no doubt. And that's the paradigm shift. That's the shift in how this is all going to work in the process. I mean, when you look down the summary of benefits, and I can certainly, you look on that first sheet, the $3,000, $6,000 is your deductible. Is there a maximum out of pocket? Yes, by law there needs to be. For an individual, it's $6,450, and for a family, it's $12,900. That maximum out of pocket includes deductibles plus all other expenses that are copays that come into play after your deductible. So remember, if I put my hand over your deductible, this is a very similar plan that you see every day out on the street. You throw in a deductible, that's where the sticker shock comes in. Is there an overall annual limit? No. There's no maxes on these plans. Okay? Very similar to an in-network HMO, you need to keep in-network. You got to keep in the Aetna network to be in benefits. They still won't pay benefits out of network. 1Source Safety will not reimburse you for going out of network. So you can't just go anywhere you want. You have to stay within the Aetna network, which is pretty common with what you've been used to. Not Aetna though. If you turn the page and you go to primary care visit to treat an injury or illness, it says $60 copay. $40 copay. Specialist visit, $60 copay. After deductible. After deductible. So, in essence, you really don't even have a copay plan anymore. And I would argue, and we've taken over some union groups where your benefits in that pre-deductible world are actually stronger than they've been in the past. You're basically, because of how this mechanism was going to work with the HRA, your first $3,000 if you're single on the plan, or your first $6,000 if you're all others, is covered by your employer. So if you have to go get a doctor's visit, it's free. If you got to go get a prescription, it's free. So that's a positive paradigm shift on how this whole thing's going to come together. So when you read these benefits, and you go down, there's a drug plan on the next page. Oh, there's a preferred drug plan, it's a $50 copay. Non-preferred, $125 copay. Specialty drugs, $50. No. This is all after deductible. So all these, you don't have a prescription plan that kicks in until your deductible kicks in. Okay? Which, again, most of your groups, if you can think back through your medical usage over the last year, I'm going to guess out of 12 people at this company, 2 or 3 families might have been possibly in deductible. That's usually the math. The 80-20, obviously a larger group, 80-20, the numbers work out a little better. Some of you are sitting here probably saying, I went to the doctor once last year. I went to a physical, and then I had that, whatever. I went to the dermatologist for something. You do some of that math, your physical, which you probably paid a copay of $40 or $50 to, that's not subject to deductible. So I want to take a little sliver out. Your preventative care physical is not subject to deductible. Okay, so that's part of the ACA Obamacare world, where they came in and said to these HSA type plans, look, you have a high deductible plan, that's all well and good, but we don't want to deter folks from getting their once a year annual, for the ladies going to OBGYN, for the men an annual physical. So that deductibles do not apply for that. But anything else, doctor's visit, you get sick, you go on the flu, you see your doc, you go to the urgent care, anything else is going to be a deductible hit. Okay? So, as I was saying in my example, most people are, I went to my primary, I went to a dermatologist. That primary visit, I paid $40, but the guy's telling me it was probably a $100 visit because of the negotiation. The dermatologist visit probably, if I didn't have insurance, might cost $250. I don't even know, meaning one typically doesn't know. And then that deductible, or after the negotiated rate, might be a $130 reimbursement for the doc. So you might have only personally spent $250, $300, $400 of monies towards medical care last year. So, again, that's obviously not near $3,000. So with a $3,000 deductible fill there, you're going to be less out of pocket in that process than you were last year. And then you go down these different, as I said, the different makeups, page 4 out of 8. There's different co-pays. There's different $5 per day in the hospital. It breaks down to a basic medical plan after deductible. Okay. Now, the HRA. The HRA, again, I keep saying that the shift in the paradigm is going to be, you're now going to get 2 cards. Okay, you're going to get an Aetna card. It becomes effective 3/1. 3/1, you are covered by Aetna. You're no longer covered by Independence Blue Cross. Cut your card, don't use it. IBC doesn't like this, but if you're about to get your prescriptions filled, let's help out the good of the team and go get them filled under the old carrier instead of the new carrier. Right? It's on you, right?
Stock up.
Stock up if you can.
Why don't you stock up?
Yeah.
There you go.
Well, no. If you're but you know what I mean. If you're on that number, yeah, you can't just go get what you want. But if you're on that number, if you can think it like that, because it's interestingly enough, I mean, now the first $3,000 of what you spend is on the company, and the first $6,000 on families is on the company. So as you transition into this 3/1, you're Aetna. You also get another card. It'll be from a company called Ameriflex. Okay, it's a credit card. It's a MasterCard, regular credit card. It's going to have your name on it. And it's basically cash, but not CVS, Walgreens, Dick's Sporting Goods. It's a credit card that will only work in the way the barcodes are read at a pharmacy. It'll only work if you're buying prescription drugs. So it'll sort, if you're getting your prescription drugs and you grab that magazine with the pharmacist and a pack of M&Ms, it's going to sort out, and that card's only going to be paying for the cost of your drugs.
Don't work at Cabela's down.
Right. So, when you have those cards, okay, the card, Ameriflex is another, I apologize for the other acronym, or TP it's a third-party administrator. It's the third-party administrator that's helping 1Source adjudicate the paying of your deductible. And the reason why Chris and the folks are setting this up is because what they could have done, they could have said, all right, when you go to the doctor, pay out of pocket, bring us your receipt, and say, hey, we'll reimburse you for the monies you just paid. They can do that as well. That gets a little cumbersome. Chris doesn't want to be in the medical re-expensement business. Employees typically don't really want to be handing their employer medical information. So at the end of the day, this is a lot cleaner in that process. There's some logistical things that I know as we go through the first month and a half, 2 months. That's why I started it backwards and saying, with 866 KTB serve, I'm always available. Chris, you can certainly give out my information. If you need to have a conversation, say, hey, how's it work again? Tell me what goes on. Two things to keep in mind. Always show your medical card. Don't be like, well, I don't have insurance because I have a $3,000 deductible. Yes, you do. You have insurance, it's Aetna. You need that card for that discount, to keep in the right track if you have anything happen to you. One. Two, ideally, the only time you use the Ameriflex card, which is the Ameriflex credit card, will be at a pharmacy. Ideally. That's the only time, ideally, you use it. Okay? We don't want you using that at the doctor's office. Because what's going to happen now is your plan, when you show your doctor your card, your plan's going to say $3,000 deductible. Each doctor's office can handle that a little differently. Okay? Depends how long you've been with your doctor, depends how good of a patient you've been, or how much, I hate to use the word trust, but how their process works. They might just bill you for your doctor visit. You show them your card. Fortunately, my docs, my wife, when she says, I take them in, I just drop the card, and then 15 days later, whatever it is, I get a bill. I get a bill from the doc. Doc gives me a bill, comes in, I write my credit card number on it, the Ameriflex credit card, I send back the bill to the doctor. And you'll see, you'll start to be probably more educated than you want to be in this process, because you'll see on that bill that the doc's charging $180 to Aetna, and then Aetna's only going to reimburse them $90, and that's the monies that you will be, or that 1Source will be paying through your Ameriflex credit card.
I just want to clarify. So let's use the example you're using about going to a doctor's visit. So what card do you show them? Do you show them the Aetna card?
Aetna.
And then
show them the Aetna.
You show them the Aetna.
Now, a couple things could happen there. Well, a lot could happen, but ideally what happens is, and this is now happening more now than it did 6 years ago. Person at the desk looks at it, you're coded with Aetna, she'll go, okay, she'll let you go back and see the doc, and then you'll say, do I owe anything? They'll say, no, we're just going to bill you, and you're going to get a bill.
Mm-hmm.
That's scenario.
They're not going to say you owe copay?
They may, and they shouldn't, but this is not everybody sitting at that desk is aware of how a high deductible plan functions. Mm-hmm. So they could say to you, you have a copay, and you could say, I don't. And they're like, well...
Yeah, I can see that conversation in my doctor's
well,
that'll go great.
Right, I'm going to tell you how it's going to, how hopefully it goes down. I have a copay. Or do you have a copay? I don't have a copay. We have a deductible plan. Mm-hmm. I have to pay out of pocket for my deductible. Because they're more familiar now with HSAs than they've ever been. They'll say, well, we need something. Right? They might say, we need a copay. They'll say, okay, here's my Ameriflex card. Here's my credit card. I want to pay my copay on my credit card. Okay? Now, they'll slice your credit card and they'll charge that credit card number. It's not going to be a copay. Meaning we all know sitting here, they're really not charging you the copay. What they're actually charging you is a portion of your deductible. But you're not there to explain that to that front desk. Mm-hmm. There's provider, trust me on this, we deal with provider relations every day with the Aetnas of the world and IBCs trying to communicate with the docs on what's going on.